Hello everyone, my name is Dr. Adib. I'm a board certified OBGYN and I'm making these videos independent of any companies or any other people. My purpose is only and only to raise awareness, have a food of thought for people who are not in medical field, and in the best possible case scenario be able to connect to someone in other fields to help fix some of the problems that I can see. So the number of years that I have practiced outside of the US still supersedes the number of years that I'm practicing in the US. And I have dedicated this video to cost of medical care. Still thinking about it boils my brain. As I said, I have something to compare with, and one subject that I want to start with is the cost of IUD, which is in the scope of my practice. So back then, outside of the US, I was part of a WHO-funded family planning to tie tubes or to insert IUDs, and WHO funded for it back then. I had no idea what the price was, and the program was very successful, was wonderful, because some people did simply not have any access to medical care, or they did not afford to do it, and the size of their families went up to 6 or 8 or 9, 12 people, and it was not good. When I entered private practice outside of the US, it was a time for me to buy IUDs for my practice. And guess how much I bought them? About 40 to 70 cents per piece. Yes, you heard it right. 40 to 70 cents. What's the price in the US, in case you do not know? $840 a piece. 840. That's a huge difference. And it's so unfortunate because for people who insurance does not cover the IUD, they never get a chance to get it and have its benefits. For people who insurance covers it, they normally don't think much about it, but it still reflects on people, and we do not realize it. It reflects on deductibles, and it reflects on your premiums. I thought long and hard about it, like what is the reason of this non-durable medical device being so expensive? Because really, what it is, it's like a T-shaped device made of plastic, sometimes copper based on the type, and or a hormone, 52 milligram of hormone, or 480 square millimeter of copper. And I searched for the weight of the device. I know the weight of the medication is about 52 milligrams, which is 0.05 grams. And I searched for the price of gold. 1 gram gold today, 29th of January 2019, is $41.89. And remember, the IUD weight is 0.5 of a gram. So it's about 1/20th of gram. This huge difference is mind-blowing. Some people may think it's because of research cost and stuff, but the reality is that we're making these devices for years and years and years, totally the same size, same amount of hormone. Of course, we make it a little bit better over time. We have tried to make it smaller, and we've done it with less medicine on it. This huge price difference really does not explain the amount of research that is needed to make smaller IUDs. Indeed, IUDs were one of the oldest ways of birth control, like years and years, thousands of years ago, when people in Saharas, they made their travels with camels. They knew somehow if they put a stone into the camel's uterus, the camels will not get pregnant, so that there will be no interruption in their long trips. And of course, we are making these type of IUDs about the same for years and years and years. So there is not a lot of research involved into it. There's not a rocket science involved into it to explain its high cost. And what makes it more complicated is that if a medical device is bought from outside of the US, a standard one, a sterile package and everything, and used in the office by a doctor, it's illegal. So it should all go through a different channel, and it should all sold to doctors via medical equipment marketers. Now, going back to another medical device, which is a liposuction device, and it's normally sold or leased with high costs to people. A doctor has found the same make and model of the liposuction machine and brought it to the office and started treating patients with a lower cost. So sure enough, the rep of that machine in the US calls the doctor and says, hey, it's not legal. I know that you're doing it in the office, but you haven't got this device from me. And so the procedure, I believe, was discontinued, but I understand FDA approval and everything. But if a device is certified internationally and it's got a package that is already sterile and everything, I don't see a lot of cost involved in approval of it and bringing it to the US. Now, another thing that pharmaceutical companies try to do is to not only make these procedures unnecessarily expensive, they try to make a false fear and a false need, and boom, then sell their products with a very high unadjustable cost. This example applies to a medicine that we used in inducing labor. It's called Cervidil versus Cytotec. Cytotec costs a few cents. Cervidil costs $200 a piece. So the rationale for making Cervidil and advertising it over Cytotec, which was a lot less expensive, is that if a uterus becomes overactive because of Cytotec, because it's like a pill, there's no way that we could wash it out. So the baby will get oxygen deprived, and it's going to be all sorts of problems called uterine hyperactivity or tachycystolia. And they've made it like a medicated flat end with a string attached to it, about 8-inch string, and it's all like a mesh cloth material. So number one, if tachycystolia happened, which by the way, the chances are very low, one very easy way to fight it is to get one bulb, which is all over the labor floor. Those are the bulbs that we use to suction out the saliva from baby's throat. So we can just make those bulbs out of normal saline or sterile water and just wash it out and sweep the vagina. That's simple and easy. And we can make it a protocol to have one in each labor room available, ready to use, sterile. But instead, everyone is pushing to the direction that Ceradyl is a lot safer, and it's just there's a string pullable. Well, it might be a little bit easier, but I'm trying to think and wrap my head around like how much this 8-inch piece of cloth made like a string attached to this medicine would cost. Like, what is the cost of this material per yard, per foot? And why is that big difference of cost? It's not explainable, and it's not really it's not defendable. One reason that pharmaceutical companies give us, if there's no research involved in making a product and putting it into the market, is cost of lawsuits. Now, this is a serious concern because I've seen lawsuits happening all over the US, and they're not standardized. For the same known complication, sometimes a defense verdict is returned, and sometimes a verdict is like $1 million. And it's also hard for me to wrap my head around what is the difference. Was that the attorney? Was it the judge? Was it the expert witness? Could be any of it or a combination of all, but still having to pay a lot of dollars in lawsuit also will have a negative effect on medical equipment. And as I said, unfortunately, eventually it will fall on patients. Patients will eventually pay for it as much as we dislike it. I read somewhere that a medical personnel gets $1 million verdict because he said something disrespectful to the patient. Now, do not get me wrong, I'm not backing that person up, but for saying something like, I'm gonna punch you in your face or something, that verdict of $1 million was given. Now, I am asking, like, based on what? What are the tiers, if there are any, that someone, a judge or someone, could use in order to measure or categorize the amount of insult to the patient, the suffering, pain and suffering that the patient went through, and base the verdict on that. As far as I know, there is no way of measuring. The lawyer just throws in their pain and suffering, and the judge or the jury totally act based on their, maybe even their mood that day. Who knows? The other reason for increased cost of medicine in the US is that, unfortunately, in this country, there is not a lot of place or almost no place for the doctor's clinical judgment. In the previous video I made in regards to C-section and normal vaginal birth, I told you that when, because of body habitudes, no prior successful vaginal birth, higher age, the progress of labor, we kind of can predict this patient's not gonna make it. And we say, I personally say it to the nurses out of the patient's room, of course, this patient smells a C-section. But unfortunately, we need to practice based on the guidelines there are. And the guidelines is that when we're inducing labor, we need to use up to 8 Cervidil to call it a quit. That 8 Cervidil, $200 a piece, keeps the patient 4 days in the labor floor. 4 days, which is a lot of cost. And then at the end, we will need to do a C-section. We need to take that baby out somehow. Now, I am not, and most of doctors are not into inducing, but there are certain medical conditions that we need to do an induction, like if the due date is past more than 1 or 2 weeks, or if there's a medical condition for mom happening, like high blood pressure, toxemia of pregnancy, or diabetes, or other conditions that needs an induction. Allowing such patients to go through labor and not listening to their bodies when their bodies close up and they're against doing a vaginal birth is that we allow a neural injury to happen potentially, meaning that if for some reason the baby's heart rate goes into a dip and it's non-reassuring and we need to immediately do a C-section, even though by the book it's 30 minutes and most of the time we can achieve these 30 minutes, but the brain tissue can suffer in a matter of minutes. Now, a lot of brain injuries happen before labor, but if it does happen during labor, it happens with normal vaginal births, and especially the births that we push and push and push on happening, unfortunately. Now, remember, the more sophisticated a tissue is, the more unforgiving it is to any type of insult. Just imagine dropping a stone and a watch, a sophisticated watch, from a certain height onto a concrete. Which one would hurt more? Of course, you know the answer. Same thing for neural tissue, for brain tissue. It's very, very, very unforgiving. Brain injury and the consequences of cerebral palsy not only affects mental capacity of the kids, but also involves physical problems and spasm of the muscles and paralysis of the limbs. It's really, really not forgivable. And you have seen kids probably on a wheelchair with like postures like that, and those cases are cerebral palsy and due to neural damage, which, by the way, as I said, about 20% of them happens during birth, but 80% of them happens before birth for multiple reasons. So, in summary, as a recap, what I suggest is to promote competitors in making medical instruments, reviewing of the medical cost, the net cost of making something versus the shelf cost. There should be someone in there. There should be already someone, but either there's a big breach in their review system or there's a very good friendship with making companies. I'm not sure which one. And as the last one, I would suggest to have tiers in determining a patient's injury in terms of pain and suffering and physical problems, so that the lawsuits are more fair and more standardized. So that was my talk about medical costs. Take care of yourself and do not believe anything or everything just because you heard it all your life, including the cost of things.